Great. I'm going to ask the secretaries some questions. I just have to stop for a minute and recognize I have two incredible daughters who have been home with two grandchildren, and they have what I think sometimes we underestimate children's ability to adapt and understand the situation when they go back to school. Because I was struck by you saying they may not know the hand washing and the personal hygiene. My 2.5-year-old knows pandemics now and germs and how germs are transmitted, and knows the importance now of washing our hands, which we would have never spent any time on before. We just would have ignored that whole thing about hand washing. But the other thing that she's adapted to is the fact that grandma and grandpa can come over, wear masks, be 6 feet apart, and she knows that she cannot invade each other's space. And I think they can learn that also about each other out of respect for each other. Even 5-year-olds of a 2.5-year-old can understand this. So it's amazing how they can follow rules when they're repeated. And I know every parent has been spending the last 4 months repeating that to their children in preparation for them to go back to school about what this really means. So, Mr. Secretary, you have amazing operating divisions that are able to look at all aspects of children, from mental health to physical health to intellectual health to development. Can you share your concerns based on all of that information coming into you about the benefits of being in school versus being in home for the child?
Yeah, and I don't want to preempt everything. I know Dr. Ellie McCants-Katz, who's our administrator of SAMHSA, the Substance Abuse Mental Health Services Agency, will be on the next panel. But schools are important and critical, not just for educating. They are actually the center of so many children's entire healthcare, mental health, social life. A great deal of nutritional support occurs in our schools. A great deal of our mental health counseling and support occurs in our schools. Most of our mandatory reporting for sex abuse or other types of on-child crime occurs in the school-based setting. And we lose all of that when they're not physically together in the school setting. So it's not just about the reading, writing, and arithmetic type learning. It's also the entire network that we have built around our children and the support system for them that exists only in that physical learning environment. And I'm sure Dr. McCants-Katz will talk in greater detail about some of the data that we have supporting how critical that setting is for kids.
Thank you, Mr. Secretary. I know that's what the Academy of Pediatrics brought to me at the very beginning, that both the telehealth, which we fought for pediatrics to be a part of, but also the fact how much the pediatrician and the school teacher all work together to really support the whole child, and how concerned the American Academy of Pediatrics was on the mental and emotional health of our children that may be in more vulnerable situations. And I think in the rush to just close things down, everything was not completely considered in that moment about how we were going to protect our children. I know, Secretary DeVos, you've been working with school system after school system to really work on these best practices on how to keep learning going. And these would be the practices that a school for a short period of time could default to in a moment of a week or two if there was an outbreak. Could you talk a little bit about what you've seen about really what creativity people have brought to this?
Certainly. There were many schools and many districts that did an awesome job of pivoting from in-person learning to distance learning this spring. I'd like to highlight just a couple of them that I'm aware of. I'm sure there are many others, but in New York City, Success Academy, a chain of charter schools that serves tens of thousands of students, mostly vulnerable students, frankly, in their school population. And within a week, they had shifted to distance online learning, and without really missing a beat at all. And it stood in stark contrast to some of their neighbors. A very good model for others to look at. Miami-Dade County, a large and diverse county. Many of you here in this room very familiar with the demographics and geography there. Miami-Dade had a really solid instructional support system that allowed for them to move to a virtual distance learning model, and had extra interventional supports for those who needed that extra boost. Another very good model for folks to look at. The International Leadership Academy in Texas, they took the attitude that learning and instruction must continue no matter what the circumstances are, and they made a really impressive shift again to the distance learning opportunity. A couple of examples closer to home here to Washington. There's a couple of suburban districts here that didn't do a very good job, frankly, and I've heard firsthand from a lot of folks whose children are in those systems how disappointed they were with really the lack of effort and the lack of competence and focus around getting helping students to continue in a distance environment. And then there is another one here in suburban DC who is offering learning through summer sessions to all of their students this summer. So a very uneven application, but all that to say, again, our expectation should be that students, no matter whether they're hopefully in person, and that should be absolutely the goal, for students to be able to be in person in school, but if whatever the circumstances dictate, require some distance for a while, if there's a flare-up of the virus in that particular school or in that classroom, that there are plans in place to be able to shift to immediately, and that can be done seamlessly. I've also heard of a lot of very creative thinking going into how to minimize the risk of students being together in the fall, and thinking about things like, where do you have choir and where do you have band? And I have heard a lot of discussion about thinking anew about learning outside as long as the weather is good, and putting up little temporary coverings or tents to be able to hold your choir classes or your band classes outdoors, where you have a lot more fresh air. And I know the medical folks among us would probably say that's a good idea. But thinking about those sorts of situations in ways that are unique to your particular school or your particular community is an imperative for all of us.
Thank you. That was so well said. And I think part of the reason for this dialogue today was to really look past and within the first dimension of where we exist in COVID-19, but to bring together those other dimensions, not only the physical, specific health around COVID-19, but the emotional and mental, intellectual health. And I think, Mr. Secretary, you talked about that at the beginning, and we have brilliant people here sharing with us, and we'll be in that third panel. But how are you tackling kind of the risk-benefit relationships of all of these different factors? And is there a way that we can bring not only a whole of government, but a whole of thought process on the three dimensions of a child and what they need, rather than the unidimensional piece of COVID-19? And how are you thinking about that?
Well, and I think we see this not just in the school context with kids, but just generally, as we talked about work or healthcare. In the healthcare setting, I've been trying to make it clear that too often we're talking about health versus reopening the economy. It's a balance between, are we going to have economic activity and healthcare, where I actually think it's health versus health. And so we're seeing kids not getting pediatric vaccinations. Millions of children are not getting pediatric vaccinations. People are not getting preventive screenings. They're not getting diagnosed for cancer. Hundreds of thousands of people are not getting diagnosed with cancer. People are literally not presenting in emergency rooms with stroke and heart attack. They didn't stop having strokes and heart attack. They're not presenting in the ER, where time is muscle and time is brain, and they need to get in. And the long-term, very real health consequences for adults and children of being locked down in your home are going to be with us for some time. And then you add the mental health issues for the kids. Children are social beings. We're all social beings, and we need to have that interaction. And we already have enough of denial of that through social media and everything else, and then we take away the physical side of it at school and those fora. And I think any one of us in this room can see in our own children the impact it has on them. In some respects, we're lucky being essential and having to go to work. We don't actually get to and have to feel all of that personally. That experience. It's important that we deal with the disease. Dr. Birx can talk more about, why we did the initial slow the spread. But that was because of a need to flatten and delay the curve of disease while we built up tools, health system, personal protective equipment, advanced on therapeutics and vaccines, learned how to deal with this disease. But now we have tools where we can manage through if we act responsibly. Acting responsibly, by the way, does not mean going to a very, very crowded bar in an outbreak area without facial covering. That would not be good individual responsibility. If we act with good individual responsibility, protecting ourselves, protecting those in our households, and protecting those that we interact with in normal society, there's no reason we can't do any of this. We have healthcare settings. We have healthcare workers. They don't get infected because they take appropriate precautions. They engage in social distancing. They wear facial covering. They use good personal hygiene. This can work. You can do all of this. There's no reason schools have to be in any way any different from the rest of what we need to do on opening ourselves up.